Okay, so today we're going to talk about something that, honestly, every single dog owner needs to know about: heartworm disease. They call it the silent threat, and for a really good reason. We're going to dig into exactly why that is, and more importantly, how you can keep your best friend completely safe from it.
Just take a look at this guy. He looks perfectly healthy, doesn't he? Happy, full of beans, ready to play. And that's exactly what makes heartworms so incredibly deceptive. In those early stages, a dog can show absolutely no signs, nothing at all while a really serious life-threatening condition is just quietly growing inside their heart and lungs. It's a really scary thought, right? But the answer, unfortunately, is yes. A single bite. That's all it takes. One bite from one infected mosquito can set off this whole chain reaction, like a series of dominoes that leads to severe lung disease, heart failure, and damage to other organs. So let's unpack exactly how that happens.
Now, I know what a lot of you are probably thinking right now. Well, my dog is mostly indoors, or hey, it gets super cold where I live, so we're safe. But I have to tell you, those are really dangerous myths. Mosquitoes are sneaky. They get inside our homes all the time. And with climates changing and people traveling with their pets, heartworm has now been diagnosed in all 50 states. I'm going to say that again, all 50 states. So nowhere is automatically safe anymore.
All right, so how does this whole invisible invasion even start? First thing to know, and this is super important, it's not contagious from dog to dog. The real culprit here is a tiny and very, very common pest. Yep, it all starts with the mosquito. Think of the mosquito as a little taxi or a delivery service for this nasty parasite. So what happens is a mosquito bites an infected animal, and that could be another dog, a coyote, a fox, and it picks up these microscopic baby worms. Those little worms then live and grow inside the mosquito for a couple of weeks until they're ready to infect the next animal it bites. And this is where that whole silent threat thing really comes into focus. So that mosquito bites your dog, and boom, the larvae are transmitted. For the next 50 to 70 days or so, those larvae are on a journey migrating through your dog's tissues. Then they find their way into the bloodstream, and their final destination, the heart and the arteries of the lungs. And get this, it takes a full 6 to 7 months for them to grow into adults that can be a foot long. A foot! That's over half a year where your dog can seem totally normal while this is happening. So if it's all happening silently at first, how in the world are you supposed to know something's wrong? Well, eventually, the damage these worms cause starts to show up as real symptoms. Let's go over what you need to be watching for. Okay, veterinarians break heartworm disease down into 4 classes. In class 1, it's really mild. You might not see anything at all, or maybe just a little cough here and there. Then you get to class 2, and that cough becomes more persistent. You might notice your dog is getting tired way more easily after just a little bit of exercise. By the time we get to class 3, things are severe. We're talking difficulty breathing, maybe even a swollen belly because the heart is really struggling to do its job. And then there's class 4. This is a true medical emergency called Caval syndrome. It's just awful. This is when the worm burden is so massive that they literally create a physical blockage, like a clog in a pipe, preventing blood from flowing through the heart. The dog will suddenly collapse. They might have dark, coffee-colored urine. And honestly, it requires immediate, high-risk surgery just for a slim chance of survival. Okay, I know that listening to all of that is really scary. It is, but here's the good news, and there is good news. If a dog is diagnosed, there is a very well-established, effective treatment protocol. So let's walk through what that road to recovery actually looks like. So the treatment isn't just a one-shot deal. It's a carefully planned process that takes a few months. It starts with a month of a monthly heartworm preventative and an antibiotic. Now, this doesn't kill the big adult worms yet, but it's crucial because it weakens them. Then, starting in month 2, the dog gets the first of 3 injections of a powerful drug that actually kills the adult worms.
And this quote really gets to the heart of it. The whole goal is this delicate balancing act. We need to kill all the worms, the adults and the younger ones, but we have to do it in a way that keeps the side effects for the dog as low as possible. And it works. The protocol is about 98% successful, but we can never forget we're dealing with killing foot-long worms inside the heart and lungs. It's a serious business that has to be managed really, really carefully by your vet.
All right, of everything we've talked about with treatment, there is one single thing that is the most important part of a safe recovery. It is the golden rule, and it is 100% non-negotiable. I cannot stress this enough. Strict exercise restriction after treatment is not a suggestion. It is a lifesaver. After those injections, your dog's activity has to be almost zero. We're talking strict crate rest. The only time they come out is for short, very calm leash walks just to go to the bathroom. No running, no jumping, no excited play, none.
And here is why that rest is so incredibly critical. When those big adult worms die, they don't just disappear. They break apart into fragments. And where do those fragments go? They travel into the lungs. Now, if a dog's heart rate goes up from excitement or exercise, it can shove those pieces of dead worm into the tiny blood vessels of the lungs, causing a blockage. It's called a pulmonary embolism, and it can be fatal. Keeping the dog completely calm for those 6 to 8 weeks gives the body the time it needs to break down and absorb those fragments safely.
Look, treatment is hard. It's expensive, it's stressful for you, it's stressful for your dog, but the absolute best news I have for you today is that this whole nightmare is almost 100% preventable. So let's talk about the easy part, building that shield of protection so you never, ever have to go through this. It really boils down to just a few simple but super powerful steps. Number 1, use a heartworm preventative medication all year round, not just in the summer, all year. Number 2, get your dog tested for heartworm every single year. This confirms the prevention is working and there are no surprises. And number 3, do what you can to reduce mosquito exposure. Dump out any standing water in your yard and try to keep your dog inside during dawn and dusk, which is when mosquitoes are most active. So why are we so insistent on year-round prevention? Because of this number, 50. Heartworm disease has been diagnosed in all 50 U.S. states. The risk is quite literally everywhere. Banking on cold weather to keep your dog safe is just not a reliable strategy anymore.
All right, to make sure we're all on the same page, let's quickly bust a couple of the most common and most dangerous myths about heartworm that are still floating around out there.
First big myth: my dog only needs prevention in the summer. Fact: the American Heartworm Society, the experts on this, strongly recommends year-round prevention. Why? Because climates are unpredictable, and mosquitoes can happily live inside our warm houses during the winter. A single missed month is a gap in the armor, and that's a risk you don't want to take.
And the second big myth: my dog stays inside so he can't get heartworm. Fact is, mosquitoes get inside. I mean, come on, we've all been woken up by that buzzing in our ear at night, right? It happens constantly. And as we've said, it only takes one bite from one infected mosquito. Every dog, indoor or outdoor, is at risk.
So when you boil it all down, it really comes to this. Heartworm is a devastating, silent disease, but, and this is the important part, it is almost entirely preventable. That simple monthly chew or topical medication is the absolute best shield you can give your dog to protect them from this threat.
So the question I want to leave you with is a simple one. Is your best friend protected? It's the one question every single one of us should be able to answer with a confident yes. Because at the end of the day, prevention isn't just medicine, it's peace of mind.
Remember, this information is for educational purposes and is not a substitute for professional veterinary advice. If you have any concerns about your pet's health, please consult with your certified veterinarian.